Hi, my name is Kalen Gunter, and I am interested in interactions between family caregivers and visiting hospice nurses. Family caregivers are one of the most important and crucial aspects of the care team, in this being that they are with the patient all around the clock and providing a lot of the hands on care when nurses and other allied professionals aren't available to. This can be a very stressful role to take on and puts the family caregiver at an increased risk for lots of stresses and depression, anxiety, which can also put the patient at different risk for different health consequences. So, this being said, it's important for the nurse to not only treat the patient as they normally would, but also to assess the family caregiver's stresses and supports and needs to ensure that the patient themselves are receiving holistic type of care. So I was particularly interested in the employment of these family caregivers and seeing if the hospice nurses assessed the employment needs and assessed how the family caregiver was dealing with things and how they were feeling, and if they felt they had enough time and energy and effort and the emotional well-being that they should to undertake this caregiving. And so I wanted to know if the nurses were engaging in these conversations and also what strategies they were using to kind of try to help to alleviate these stresses. So, the methods that we went through, I first took an analysis of a parent study in which these audio recordings of hospice nurses going into patients' houses that were on hospice care who had advanced cancer. And these audio recordings were transcribed verbatim, which ended up with 70 recordings, which were included in that analysis. And then from that analysis, we screened the conversation for descriptor words about employment, such as employment, job, work, boss, supervisor, manager, among others. And then using these transcriptor words, we used the transcripts that were relevant and coded them for the type of nurse family caregiver interactions, as you can see in figure 1 of my poster. We found that some of the interesting demographics, the FCG's family caregivers were mostly white and female with an average age of 65, and 29 were employed, with 8 employed part-time and 21 employed full-time. And then the results about the interactions, we found that the family caregiver initiates conversation about employment, or did initiate conversation 29 times, 19 of which the nurse didn't pursue further questions or ask them anything about their stress. But 5 of the times the nurse did ask further questions, and 5 other times the nurse offered suggestions, advice, such as a hospice aid or respite care. We also found that the nurse initiated a conversation about the family caregiver's employment 3 times, whereas the nurse initiated a conversation about employment, their own employment, 14 times. The results of this study kind of offered really good insight between the communication between nurses and family caregivers. It showed that family caregivers initiate conversation more frequently than the nurses, and the nurses do not often pursue the conversation when it arises. Obviously, further research is needed to examine the frequency, context, and content of these conversations about employment and to understand how this can affect the family caregiver's physical and emotional well-being. Thank you.